This next set of Chapter 21 videos will focus on principles of gas exchange and gas transport. These are subjects that are crucial to the overall function of the respiratory system. So let's get started with some basic information. The air that we breathe is actually a mixture of different gases. Oxygen gas, nitrogen gas, argon, water gas, and carbon dioxide are some of about a dozen different types of gas molecules that exist in our air. Nitrogen gas makes up the largest percentage of our air. Approximately 78% of our air is made up of nitrogen. An interesting fun fact, though, is that our cells do not metabolize nitrogen. It's in our tissues, it's in our cells, but we don't use it in any of the biochemical machinery within our cells. Oxygen gas makes up the second largest percentage of our air. Roughly 21% of our air is made of oxygen gas. And the other different gases within that mixture of air make up only fractions of a percent of the total gas mixture. So we need to focus on a couple of different principles here to help us understand how gases are exchanged between our lungs and our blood supply. So the first important principle that we need to understand is Dalton's law. Dalton's law basically states that in a mixture of different gases, that each gas contributes a portion of the total pressure. We also refer to that as partial pressure. So each individual gas has its own partial pressure. So if we look at a mixture of gases, for example, if we were considering the air we breathe, it is a mixture of different gas molecules: nitrogen, oxygen, carbon dioxide, water, and all the others that are part of that general mixture. So all of those gases together create the total pressure for that system. But each gas contributes a certain percentage or certain portion, and we call that the partial pressure. So in this example, we have a mixture of gases, gas A, gas B, and gas C. So within a quantity of that gaseous mixture, gas A contributes a partial pressure, P sub A, or partial pressure of A. Gas B contributes a partial pressure, and we can refer to that as P sub B, or partial pressure of B. And gas C contributes a portion as well, and we can refer to that as P sub C, or the partial pressure of gas C. So all of those together, when added together, make up the total pressure of this system. So in summary, Dalton's law describes that within a mixture of gases, each gas contributes a partial pressure to the total pressure. So the sum of the partial pressures equals the total pressure. Another important principle that we have to understand is Henry's law of solubility. So with Henry's law, if you can imagine a syringe, similar to the syringe that we considered previously when talking about Boyle's law. In our syringe, we have a mixture of a liquid and some gas. So we have a gas-liquid system within our syringe. So in the liquid portion, we have molecules that are bumping around and moving around within that quantity of fluid. And above that liquid portion, we have a volume of gas, which also has molecules in it, and they're bumping around, bumping into each other, bumping into the walls of their container. So if we take that liquid gas system and we apply pressure to that system, like we did with the syringe, the added pressure to our system is going to force the gas molecules into the liquid portion. So basically what Henry's law of solubility describes is that in a liquid gas mixture, the higher the pressure applied to the gases, the more of those molecules will enter the solution or become more soluble. So if we were to drop the plunger even further, then we would push even more of those gas molecules into the solution. So an easy way to kind of think about this type of system is to consider a can or a bottle of soda. When you have a can of, say, carbonated liquid or carbonated water or any liquid with carbonation in it, the carbonation within that can or within that bottle is under a high amount of pressure. That's how it's packaged. So when they seal up the carbon dioxide gas inside of that soda can or soda bottle, the pressure forces the carbonation or forces the carbon dioxide molecules into the solution. And so when you open the soda can, you hear a giant fizz often. And so the fizzy sound is the gas molecules escaping from its container. So like the soda can, you have gas under pressure, and the gaseous molecules are going to enter the solution. But then when you open up the can of soda, you release the pressure and the gas molecules basically escape. So to summarize one more time, Henry's law of solubility describes how a liquid gas system, when under pressure, causes the gas molecules to enter the solution and become more soluble in that solution. However, when you release the pressure of that gas liquid system, then the gas molecules escape back into the gaseous portion. So those principles lead us to understand what is happening between the lung tissue and the surrounding blood vessels or blood supply. So when it comes to exchange of gases between the alveoli and the blood, there's a few certain factors that influence the efficiency of that gas exchange. Firstly, the gas pressure between the alveolar air and the blood has to have a pressure gradient associated with it. A second factor has to do with the total functional surface area of the respiratory membrane. All the alveoli within the lungs confer a surface area to them. So if you were to take all the small little air sacs and squish them out flat, you would see that there is a surface area associated with all of those alveoli. However, if there is disease or removal of lung tissue, that reduces the overall surface area available for the gas exchange to take place. So the amount of surface area is very important. Fun fact, if you were to measure the surface area of lung tissue, it would roughly be equivalent to half a tennis court. So that's a lot of surface area, but that is very important for gas exchange. Also, the distance through which gaseous molecules have to travel will also dictate how efficient gas exchange is. So if the gas molecules have to travel a great distance, that just kind of slows up things. Another factor that influences gas exchange is the respiratory minute volume. So in other words, how many breaths you take over the course of a minute will dictate how much gas exchange is taking place. So a slower respiratory rate will have less diffusion or less gas exchange occurring. Also, too, alveolar ventilation. So the air has to get to the alveoli in order for those gas molecules to have any chance of entering the blood or leaving the blood. So if there's disease or inflammation, that reduces the amount of air that's entering each alveoli. Also, too, perfusion of lung tissue. The alveoli are surrounded by numerous capillaries, and if the blood flow through those capillaries is somehow inhibited or obstructed in some way, then the perfusion of blood or the flow of blood past the alveoli will not be as efficient. Now, a couple of important points here, which go back to some topics that we've studied previously, have to do with the structure of alveoli and capillaries. If you recall, capillaries are made of simple squamous epithelial cells, so basically a tube of epithelial cells. So that makes them very thin, and that helps with gas diffusion and gas exchange. Also, too, alveoli are also made of simple squamous epithelium. So those thin cells also help make the gas exchange process more efficient. So between alveoli and capillaries there's not a great distance for the gas molecules to travel, so that makes it a lot easier. Also, one more thing is that if you recall from capillary structure, capillaries are only about as wide as one red blood cell. So the red blood cells, which are helping to transport oxygen and carbon dioxide, come very close to the alveoli. And so that also helps to make oxygen and carbon dioxide transport a lot easier. All right, so now that we have these principles in mind, let's consider the gas exchange process that's taking place between the alveoli in the lungs and the pulmonary vessels. So let's consider this diagram here on page 829 for a few moments here. As you know, the air we breathe is a mixture of gases. However, the two probably most important gases that we need to consider here are oxygen and carbon dioxide. Our body cells need oxygen in order to generate ATP, which is needed for driving many cellular processes. But in the course of making ATP, our cells also make carbon dioxide. And we have to get rid of the carbon dioxide because that can alter the pH of our blood and body fluids. But let's consider here the movement of oxygen and carbon dioxide between the alveoli and the nearby pulmonary capillaries. So the air we take in has oxygen within it. That oxygen, which is in the alveolus, needs to make its way into the blood. And because the alveoli and the capillaries are made of thin, simple squamous cells, that makes it easier for the oxygen to make its way into the blood and hitch a ride on red blood cells. Now, let's consider the partial pressure of oxygen in the alveolus. The partial pressure of oxygen in the alveoli is 104 millimeters of mercury. Now remember that the total pressure of air is approximately 760 millimeters of mercury. So oxygen is roughly about 21% of that total. Now, what we have to also realize is that the partial pressure of oxygen in the pulmonary capillary, though, is only about 40 millimeters of mercury. So I hope what you can see right off the bat is that we have a pressure difference between the alveoli and the pulmonary capillary. So because we have a greater partial pressure in the alveolus than we do in the pulmonary capillary, that's going to promote diffusion of oxygen from the alveolus into the capillary. Because as we know, gas molecules like to travel down their pressure gradients, and we definitely have a pressure gradient right now with oxygen. And that pressure gradient is from the alveolus into the pulmonary capillary. All right, so let's consider the partial pressures of carbon dioxide for a moment. The partial pressure of carbon dioxide in the alveolus is only about 40 millimeters of mercury. However, the partial pressure of carbon dioxide is about 45 millimeters of mercury in the pulmonary capillary. So we do have a pressure gradient here, and the difference between the two pressures is not very big, but it's big enough that carbon dioxide molecules that are in the pulmonary capillary are going to exit the blood and move into the alveolus. And if you think about it for a moment, that sort of makes sense because our cells are generating more carbon dioxide. That carbon dioxide is going to be in a higher concentration or higher partial pressure in the blood. So that higher pressure is going to lend itself to diffusion of carbon dioxide into the alveolus. Now, we've only told really about half the story here. The other half of the story is seen in the lower part of this diagram. And the second part of this story has to do with the exchange of gases between the blood and between the body cells. So previously we saw how oxygen made its way from the alveolus and into the blood, and specifically onto the red blood cell, where it hitches a ride. The red blood cell then delivers that oxygen to the tissue cells. And keep in mind, the partial pressure again for oxygen is roughly about 100 in the systemic capillaries. However, the partial pressure of oxygen in the tissue cells, though, is only about 40. And in some ways that makes sense as well, because our cells are consuming oxygen in order to make ATP. So there's going to be a higher partial pressure or higher concentration of oxygen in the blood or on the red blood cells than there is compared to the partial pressure inside of the body cells. So that pressure difference promotes movement or diffusion of oxygen into the body cells where it can be used to make more ATP. Now, if we consider carbon dioxide, remember that the cells are generating carbon dioxide as part of its metabolic processes to make ATP. And so the partial pressure or the amount of carbon dioxide that's being produced is roughly about 45 millimeters of mercury. However, the partial pressure of carbon dioxide on the red blood cells or in the systemic blood is only about 40. But that's just enough of a pressure difference to promote diffusion of carbon dioxide onto the red blood cell or even into the plasma. So now we've more or less completed the gas exchange process. The process of taking oxygen from the alveolus, transferring it to the blood, where it then diffuses to the body cells and tissues. With carbon dioxide, we have production of carbon dioxide in the body cells. That carbon dioxide makes its way into the systemic capillary or onto the red blood cell, where it travels to the alveolus, where it then diffuses from the blood into the alveolus. So all of that movement, all of that diffusion of oxygen and carbon dioxide occurs through pressure gradients. And then the process repeats itself. So here's another view of that overall process on this diagram on page 832. So we have gas molecules in the alveolus, namely oxygen. Those oxygen molecules are going to diffuse into the blood and hitch a ride on hemoglobin. The hemoglobin then delivers that oxygen to the tissue cells. And after that delivery of oxygen takes place, the hemoglobin has less oxygens bound to its heme molecules. And so the hemoglobin then has to sort of make its way back to the lungs to be refreshed of oxygen. And so then the red blood cell with its hemoglobin then picks up more oxygen molecules, and then the hemoglobin then takes the oxygen back to the tissue cells to ultimately deliver that oxygen. But regardless, all of this diffusion of gases between the lung, the blood, and the tissues, and then back to the lungs again, is all dependent on partial pressures and a pressure gradient. So taking advantage of these partial pressures can be put to therapeutic uses as well. There may be unfortunate occasions where someone has been, say, exposed to carbon monoxide gas, which binds very, very tightly to hemoglobin, or if someone has experienced decompression sickness or the bends from, say, scuba diving, or if someone has troubles with wound healing, for example, diabetics. A special device called a hyperbaric chamber can be put to use to deliver oxygen under high pressure in order to offset or promote additional transport of oxygen to tissues, to try and either promote, say, wound healing, or to help displace carbon monoxide from hemoglobin. So hyperbaric chambers are these little tube devices where someone lays inside this big tube and they apply high pressure oxygen to that person. And so having that extra high pressure of oxygen helps to promote more diffusion of oxygen into the blood, and depending on what purpose there, can help to basically transport more oxygen to the tissues. Now, hyperbaric chambers deliver about 4 to 5 times atmospheric pressure of oxygen to a person. And a person would spend maybe a few hours within the hyperbaric chamber to get the best benefit from that application or those therapeutics. So anyway, we're very fortunate to have a number of hyperbaric chambers here in the Knoxville area for such purposes as needed. So this is one way to exploit a high partial pressure of oxygen and help to deliver some type of therapy as well. All right, so to round out this portion of information, I encourage you to go into Brightspace, go into our content, and look up the gas exchange video. So it's just a little animation that shows the movement of gases between lungs, blood, and tissues. It's about 3 minutes long. Unfortunately, I can't play this for you in this particular format here. So before we end this video, I have one review question for you to consider. The question is, Henry's law states that A, in a mixture of gases, the total pressure is the sum of individual partial pressures, or is the answer B, the volume of gas that will dissolve in a solvent is proportional to the partial pressures of that gas? Or choice C, gas volume and pressure are inversely proportional. All right, after considering those answers, I hope that you chose B, because B best completes the statement. The volume of a gas that will dissolve in a solvent is proportional to the partial pressure of that gas. If you chose A is actually a description of Dalton's law. If you chose C, that description describes Boyle's law. So just make sure that you know the definitions of those laws, because you will be asked that on the exam. All right, well, that concludes this presentation. Thanks for your time and attention.